questions focused on Trichomonas vaginalis, with detailed explanations and rationale for incorrect options. Question 1. Clinical presentation. A 29-year-old woman presents with vaginal itching, burning, and a foul-smelling greenish discharge. On pelvic exam, her cervix appears inflamed with punctate hemorrhages. A wet mount shows motile trophozoites. What is the most likely diagnosis? A. Bacterial vaginosis. B. Trichomoniasis. C. Vulvovaginal candidiasis. D. Chlamydia trachomatis infection. E. Gonorrhea. Correct answer, B. Trichomoniasis. Explanation. Key findings: green, foul-smelling discharge, itching, strawberry cervix, and motile trophozoites on wet mount, caused by Trichomonas vaginalis, a protozoan parasite. Why not the others? A. Bacterial vaginosis, thin gray-white discharge, clue cells, no inflammation. C. Candidiasis, thick, white, cottage cheese-like discharge, no foul smell. D. Chlamydia, often asymptomatic, may cause cervicitis but not motile organisms on wet mount. E. Gonorrhea, mucopurulent discharge, intracellular diplococci, not motile protozoa. Question 2. Transmission and diagnosis. Which of the following statements is true regarding Trichomonas vaginalis? A. It is transmitted via fomites and can survive on toilet seats. B. It forms cysts that are visible in stool samples. C. It is a protozoan seen as motile trophozoites on wet mount. D. It is treated with azithromycin to cover co-infections. E. It causes painless genital ulcers. Correct answer C. It is a protozoan seen as motile trophozoites on wet mount. Explanation. T. vaginalis does not form cysts and cannot survive outside the human body. It is diagnosed by identifying motile trophozoites in vaginal secretions via wet mount. Causes a sexually transmitted vaginitis with inflammation. Why not the others? A. Cannot survive outside the body, strictly sexually transmitted. B. Does not form cysts. D. Treated with metronidazole, not azithromycin. E. Causes vaginitis, not ulcers. Ulcers suggest HSV or syphilis. Question 3. Management. A 33-year-old woman is diagnosed with trichomonasis after her wet mount reveals motile organisms. She is treated with metronidazole, but symptoms return a few weeks later. Which of the following is the most appropriate next step? A. Prescribe a second dose of metronidazole. B. Treat the patient's sexual partner. C. Switch to fluconazole. D. Perform endometrial biopsy. E. Reassure the patient. Symptoms will resolve spontaneously. Correct answer B. Treat the patient's sexual partner. Explanation. Reinfection often occurs if sexual partners are not treated simultaneously. CDC recommends treating both patient and partner with metronidazole to prevent reinfection. Why not the others? A. May be helpful, but partner treatment is essential. C. Fluconazole is for candida, not protozoa. D. Not indicated in uncomplicated vaginitis. E. Trichomoniasis does not resolve spontaneously. Let me know if